My palms are sweaty, my stomach is upset, I feel tense, my head is aching, and I have an overall feeling of dread. What I am experiencing, you have probably experienced too. You may have been worrying about taking an exam or giving a speech, or maybe you're just worried about a family member. This type of worry I am describing to you is anxiety. Anxiety is defined as a complex combination of the feeling of fear, apprehension, and worry, often accompanied by physical sensations such as palpitations, chest pain, or shortness of breath. In fact, anxiety is the body's natural response to danger. It is part of the body's fight or flight response. It prepares us for danger. It is a normal response to trouble or feeling unprepared. However, if your anxiety is persistent and interferes with your daily life and relationships, you may have an anxiety disorder. According to the National Institute of Mental Health, anxiety disorders affect about 40 million American adults age 18 or older. That is about 18% in a given year. Unlike brief anxiety caused by a stressful event, such as speaking in public or a first date, anxiety disorders can last at least 6 months or can get worse if not treated. As a college student, we are faced with so much pressure to do well and to fit in. Between school and work, friends, and being on your own for the first time, you're pulled in many directions. Worst of all, you are so busy that you do not take good care of yourself. With all of these added physical and emotional changes, who would not be anxious, right? We all get stressed and anxious, but we bounce back. However, if you are experiencing anxiety that is frequent and it hinders you in your daily activities, then you may have an anxiety disorder. The good news is that it is treatable and there is help out there. According to the Anxiety Disorders Association of America, or ADAA, anxiety disorder is associated with 6 medical disorders. Although the symptoms may vary for each anxiety disorder, they all cause extreme fear and worry and interfere in your daily life activities. The 6 disorders associated with anxiety are generalized anxiety disorder, social anxiety disorder, panic disorder, specific phobias, obsessive compulsive disorder, and post-traumatic stress disorder. Generalized anxiety disorder, often referred to as GAD, is an excessive and uncontrollable worry about everyday issues that include work, school, friends, family, money, and health. Social anxiety disorder is an avoidance of everyday social situations that are due to anxiety caused by a fear of being judged by others or a fear of being embarrassed or ridiculed. Panic disorder is severe attacks of terror, which may feel like you are having a heart attack or going crazy for no reason. Another type of anxiety is specific phobias. Specific phobias are an intense fear that leads to avoiding an object, place, or situation, such as driving on a bridge or riding in an elevator. Another type of anxiety, obsessive compulsive disorder, also known as OCD, is persistent recurring obsessions that reflect exaggerated anxiety or fear that manifest into repetitive behaviors such as an uncontrollable need to scrub your hands repeatedly or the need for compulsive neatness and order. Lastly, post-traumatic stress disorder, or PTSD, consists of avoidance, detachment, the inability to sleep and concentrate, or reliving a traumatic experience from several months or years after it has occurred. All of these disorders are real medical conditions that require treatment. So take the time to figure out if your anxiety falls under any of these descriptions and seek medical attention from your physician or school counseling center. If these conditions were to go untreated, they can result in dropping out of school or, even worse, suicide. According to the JED Foundation, an organization that works with college students to improve mental health, the average age for the onset of mental health conditions is typically 18 to 24 years of age. In fact, 1 in 8 students will experience anxiety or a panic attack. According to the National Institute of Mental Health, about 75% will have the first episode by age 22, and anxiety is more common in women than in men. The physical symptoms that may be experienced are sweating, chest pain, dizziness, a pounding heart, shortness of breath, muscle tension, headaches, fatigue, insomnia, feeling tense and jumpy, or a feeling that your mind has gone blank. You also can have a combined feeling of dread, insomnia, and nausea. These symptoms can be crippling and even fatal if not treated. An untreated anxiety disorder can lead to serious health problems and can result in the dropping out of school. In fact, anxiety is often the top reason among women for dropping out of school. New scientific studies have shown that having an anxiety disorder is a risk factor for attempting suicide. For those who are experiencing any symptoms of anxiety, the first step to take is to seek treatment. According to the 2006 study, embarrassment was the number one reason someone would not seek help. Only 23% would feel comfortable enough to talk with a friend about seeking help for emotional issues. Students may be concerned about confidentiality, and these concerns can cause students to keep their emotional troubles to themselves, making life more difficult than it has to be. For students struggling with anxiety, the best place to get help is the on-campus counseling center. If there is a waiting list, you can call the National Suicide Prevention Hotline, which does not just handle crisis. Students can get advice and have someone to talk with about the anxiety that they are experiencing. To combat anxiety, work on coping skills and know your limits. In addition, lifestyle is directly related to your emotional health, so it is important to get enough sleep, eat well, exercise, and avoid excessive drinking and caffeine. For additional resources, not to take the place of treatment, there are reputable websites you can visit for more information that is helpful on dealing with anxiety. U-Lifeline offers a screening tool developed by the Duke University Medical Center and contact information for the university counseling centers. The JED Foundation provides resources and research on mental health and suicide prevention for parents, students, and colleges. Campus Calm offers tools to combat stress for high school and college students also. Health Central offers a few anti-anxiety tips for students, and the most important tip is to first talk to someone. Reach out to a friend, a roommate, boyfriend, girlfriend, family member, or your counselor. Do not keep things bottled up. Find out what triggers your anxiety. Keep a journal and document when you feel anxious or stressed, and then review it, looking for patterns. Put things into perspective and think about your situation. Ask yourself whether it is really as bad as you think it is, or could you be blowing it out of proportion. Do your best instead of trying to be perfect. Perfection is not possible, so be proud of however close you get. Take time out, clear your head of all the problems you're facing, take a deep breath and count to 10. Get a massage, meditate, listen to music, or learn a relaxation technique. Physical activity keeps the mind and body fit. Therefore, exercise is a necessity, and it's a stress reliever. Eat a balanced diet, stay away from caffeine. Caffeine can trigger symptoms of panic attacks. Also, limit your alcohol intake. Alcohol aggravates anxiety disorders and can trigger panic attacks. Most importantly, relax, take a deep breath, and maintain control. I hope that the information I have shared with you will be helpful when you are feeling overwhelmed and anxious. The good news about anxiety is that treatment is successful and help is available. If you would like to receive a pamphlet on anxiety, you can request one online at Got Anxiety. Speak to someone about your anxiety, relax, and take your life back. Do you have any questions?
If I'm experiencing any symptoms, how long should I wait before I see a doctor?
If your symptoms last for 6 months or longer, you would need to seek professional help. Anything else?
What is the National Suicide Prevention Hotline number?
It's 1-800-273-TALK. And I also have these handouts for you that give you information on anxiety disorder. If you have any further questions or you need any more help, you can refer to your pamphlets. I hope that my information has helped you. Thank you.